In 2003, you all, literally everyone would have hated me. Biggest jerk of a jerk doctor you ever would have met in 2003, biggest ego of any doctor I think that was ever created. And when I walked into my community, I told everybody how blessed you are that I'm here now. And in the next 2 years, I noticed that there was a separation in my patient population. There are patients that were seeing the local chiropractor that were healthier than my other patients, and they were doing some other things for their health other than just using medication for whatever condition they might have. They also had a lower vaccine uptake, and they were healthy, and that was really hard for me to recognize. My partially or unvaccinated patients, and none of us liked them, quite honestly, back then. They were going against their medical doctor's advice, and with the ego that I had, that was really hard to swallow. And the moment I started reading research about vaccines, changed my life forever. I didn't know anything beyond the vaccine information statements, where we find out that vaccines are perfectly safe, you'll become immortal if you vaccinate, and if you don't, all the babies in the world will die. And that's what the CDC wants us to believe, and I understand why they say what they say. We're medical doctors, and we're infallible. When we received our medical degree, we inherited the wealth of the knowledge of the universe, and at that moment, we knew more than anybody. And it's very scary to think that that isn't true. Now, not every doctor feels that way, but I would hazard to guess many do in my interactions and my experiences. And so if we step back and we realize that not everything needs a medicine or a surgery, that maybe our bodies are designed pretty perfectly and we can step back and let our bodies heal, I think that many physicians would be surprised that they don't need the medicine. And on a business side, you can make almost as much money, which is pretty cool too. You make a little bit more money if you prescribe a medicine, but ultimately it's about providing care. Doing this for 15 years now, I'll share with you that the vaccinated kids are the sickest, the partially vaccinated kids are not as sick, and the unvaccinated kids are the healthiest. Vaccines are different because we're making a recommendation suggesting that they're perfectly safe, and they're not, and we're hurting kids, but we won't know it or admit it unless we read. My hope is that physicians, under the pressure of parents, will stop and actually read about it. They'll read some great books that are out there. They'll actually go to peer-reviewed research and study the vaccine ingredients, as opposed to what the pharmaceutical representative hands you when they're selling you the vaccine. I read about an hour a day about vaccines, and I work with moms in my practice that read 10 hours a day. They know more than I do, and that's amazing. And to all the medical doctors who are watching this, I'm sure they know more than you do. There are a handful of doctors in our country that know as much as these moms do, because once your child was injured by vaccines, you'll never stop researching it.